very good morning to you. How are you doing? I hope that you're well, you're happy, you're blessed. Karibu sana. This is MBCI TV, ambapo tunabadilisha maisha by the grace of God. And I'm so excited, so blessed to be here this last Wednesday of August. It's the 27th of August, 2025. And I'm happy and blessed to be here. I hope that you are as well. And of course, this is Afya Clinic, where we talk about everything that concerns your health. And we're happy to be unpacking this particular topic that we've been telling you about. And we told you that today we'll be talking about hypertension. Just to get to understand hypertension ni nini, how does it present? If you've had anyone ambaye amekuwa na hypertension, is it the same na high blood pressure? Is there anything like low blood pressure? Yeah, all that. So if you have any question, today is the day that we answer all those questions. My name is Rachel Kahugu. I'll be your host today. Natokwa hapa mpaka 10 in the AM. And today we'll be having Dr. Eugene, who I'll be introducing in a very short while. But before I do that, karibu sana. Thank you so much for choosing to watch MBCI TV. Our numbers are very open. That is 0721 105 105 on WhatsApp, 23814. SMS code, which is absolutely free of charge. We're live on Facebook on MBCI TV Facebook page. We're live on YouTube on MBCI TV official YouTube page. On all social media pages at Rachel Kahugu pia, nitaweza kupata ujumbe wako loud and clear. So I'll be happy to hear from you. Share with us and tell us, one, how your week has been. What exactly you're thanking God for. I know there's so much to thank God for. Yeah? And today we're here just to know, what is that you're thanking God for? So talk to us and we'll be happy to hear from you. Now, Doc is already here with us, and today we are having Dr. Eugene Msungu. And we've been talking about having this discussion, and this is the right time to have this discussion. So if you have any question, this is the time for you to ask. And this is for hypertension pekeke. But if you have any other topic that you'd love for us to talk about, please feel free to tell us through our WhatsApp number, and we'll slot another show that will be talking about that particular topic. But today we're talking about hypertension with Dr. Eugene. Karibu sana.
Thank you so much.
How are you?
I'm okay.
Good to see you.
Thank you.
Yes, karibu sana. Please say hi to the viewers. That's your camera. Yeah, introduce yourself.
I'm glad to be here this morning.
Yeah.
My name is Eugene Msungu. I'm a medical doctor. I'm glad to just be able to have this conversation about high blood pressure.
Yeah.
Or hypertension, and I hope that this is going to be very engaging for all of us, and that we're going to be knowledgeable, and then we'll be able to use that knowledge to better our lives.
Yeah.
Yes.
Perfect. Now I know the viewers have seen you somewhere else. I know him from Kabarak. I know him from here and there. So please tell them. Wanakupatanga wapi kwingine? What else do you do?
So I currently work at Sterling Healthcare Consultants. That's at Jennifer Rehab 4th floor. Formerly, I was working for Kabarak University for the last 13 years. I exited Kabarak end of June, and I'm now currently working at Sterling Healthcare Consultants. So you'll be able to get us there most of the times, because we operate an outpatient facility during the day between 8 and 7. Okay. Weekdays and Saturday and Sunday between 9 and 4.
Okay. So what are some of the services that you offer?
Well, we offer general outpatient consultation. We offer specialist clinics, mostly for chronic diseases, hypertension, asthma, diabetes, thyroid diseases. And then we also have laboratory services. We have imaging, that's ultrasound. And then we also offer physiotherapy services, and then vaccinations, immunization for the children, vaccination for adults who will be traveling from this country to other countries. And we're also able to do minor surgical procedures at our facility. And we take both cash clients and also corporate clients who are insured under different schemes. Majorly all the major insurance schemes, we are able to extend our services to those who have those insurance covers. Okay. So you're always welcome to our facility. We are a friendly team, and we offer our services also with consideration of the living costs at the moment.
Okay. Yes. Perfect. Asante sana. Now, today we're talking about hypertension. And every time we mention hypertension, it sounds like a huge word.
Yes.
In ugonjwa fulani, we need to sit and talk about. But in layman's language, what is hypertension?
In the simplest way, hypertension, high means something that is more, you know. Then tension means that there's a bit of pressure or tightness. So hypertension is basically high blood pressure within the blood circulation, the arterial circulation. The blood has majorly two mechanisms where blood circulates in the body. There's the arterial circulation when the heart pumps blood to the rest of the body. And there's also the venous circulation when that blood now is coming back to the heart. Yes, so that it can be pumped to the lungs. So when there's high pressure, when the heart is pumping blood to the rest of the body through the arterial circulation, that is when there's high pressure. That is what we call hypertension. And there are certain values that we use to be able to determine what is high and what is normal and what is low.
Let's go there. Now, how do you know that now this is high? Maybe let's start. What's the normal blood pressure?
The normal blood pressure. Normal blood pressure, and blood pressure is assessed on two parameters. One, parameters means just more like values, or just the aspects at which we look at the blood pressure. One is because blood is pumped to the rest of the body from the heart, so the heart has to contract and pump that blood. So that is what we call systolic. The contracting effect of the heart is what we call the systolic pressure when we assess the pressure of the blood as a result of that contraction. So that is a value that is always indicated on the upper part because the blood pressure has a numerator, if we remember our maths back in primary school, and a denominator. So the simplest way, we can then say math inanisaidia aje. Ukijua kuna numerator, which is the upper reading. And so the numerator, which is the upper reading, is the systolic pressure. Then the lower reading is diastolic pressure. And diastolic means the relaxation, the pressure when the heart is relaxing. So the heart contracts, pumps blood, relax, receives blood back. So that is what we call systolic and diastolic. So normal would be, for systolic, which is the upper reading, values between 90 and 120. Yes, that's normal. Well, the best ways, especially in terms of the parameters we look at, is between 90 and 139. That would be normal. Yes.
Why 139?
139 because there's an aspect in which we say now this above 140 and above, that's high blood pressure. So between 130 and 139, that's what we call high normal. So basically then we can look at it this way. There's what is optimal, just what we say, this is good, we're very good with you, we are easy. So that would be values between, the upper value, that would be values between 90 and 119. Any value below 120, but not necessarily below 90, in between 90 and 119 for the upper reading, normal. We're very easy with you, we're very optimal. And for the lower reading, then is between 60 and 80. For the lower reading, when the heart is relaxing, between 60 and 80. So that one we are okay. So then there are also way we look at, is it normal? Is it high normal? Yes.
So the high normal, because there's high, which is dangerous, which I assume is what you're talking about as hypertension.
Yes, exactly.
And then you've mentioned we have the high normal.
Yes.
So how okay is high normal?
High normal is as okay as if you are able to just maintain that value through lifestyle modifications. You don't have to take medication, but it gives a hint that you are likely to develop. You are likely, you know. Okay. So you start taking early precautions when it's high normal. You start taking early precautions.
Okay, I hear you. Now, you've had people calling or terming hypertension as a silent killer or a silent disease. Why is that?
Well, silent means something that doesn't make noise.
Yeah.
Is that? Yes. Yeah. So there are diseases which, as they come into our body, as we get to realize them, they make noise. And making noise in this case would be there are certain expressions. Those expressions, as what in the medical language we call them symptoms, expressions, symptoms, where a patient would say, somebody coming to you say, I feel a headache, I feel tired. Those are symptoms. Okay. And also there are also signs. Signs are the ones that you can visibly see. Yeah. So hypertension would be prevalent in somebody's body without those expressions, without the symptoms and without the signs. Okay. So that is why we term it silent. And it can kill you. By the time we are realizing you are hypertensive, you're already dead. So you are silently suffering from hypertension and no one knew about it.
Not even yourself.
Not even yourself. And then you passed on. Then at postmortem, when the body is being analyzed, it's realized that you are hypertensive.
Okay. Yeah. Now, because it's a silent disease, then how would you know that you have hypertension? Do you have the very subtle symptoms that you'd realize, probably this is hypertension, let me just go get checked? Yeah.
Okay. It's not possible to say it's silent and it's subtle. Because then if it's silent, it's silent.
It's just silent.
Yes. So there has to be a way we need to know. And the only way we need to know is by taking our blood pressure reading. Okay. Assessing what is our blood pressure. So doing regular checks is the only way you'll be able to know. Okay. Because it would be, you may be hypertensive and you don't know. Yes.
Okay. So that means at kama uko sawa, you have no symptoms, just
check your blood pressure.
Just check your
blood pressure once in a month. Check your blood pressure if you can. Every 2 weeks, check your blood pressure. As often as you get an opportunity to, check your blood pressure. Okay. But importantly, at least once in a month, check your blood pressure.
Yeah, I hear you. Now, we want to know, now that you're talking about hypertension, as you said, it's a silent disease, so we have to go get checked for us to know that you're probably suffering from this and now know what to do next. How common is it in Kenya? In your line of duty, say how many people? What's the statistics? Okay,
we are how many people in the world so far? We're almost 8.2 billion.
Because in Kenya we're like 50 million.
We're about 50 million in Kenya. In the world over we are 8.2 billion, I think so. Almost that number. In the statistics that are there, and those are things that we get to learn from what the World Health Organization will be able to assess from reports from different regions and look at the evaluations that have been made by the practitioners. It's estimated, the estimates are that we have about 1.3 billion people, adults. Out of the 8.2, we have children and we have adults. So precisely, we have about 1.3 billion people of the age category between 30 years and 79 years who are hypertensive. Estimated.
Estimated.
But the numbers that are actually there, in terms of those who've been diagnosed, are probably halfway. So in Kenya, we'll be talking about statistics of about 6-7% of those who are diagnosed of our population among the adults. So those are the figures we are talking about.
Yeah.
But again, we think there's a majority of almost double the numbers of those who are known, of almost the same number of those who are known who have not been diagnosed.
Yeah.
So probably our figures looking at the region would be probably about 15% of adults are hypertensive.
Yeah, that's a huge number.
That's a huge number, yes.
It is. It is.
I mean, really, if you have 10 people, you probably have about 2 of them, 1.5 to 2.
Yeah. Yeah.
You don't have
in 10 people.
Yeah, in 10 people, about 2 people.
Yeah. That's a huge number.
That's a huge number.
Okay. So what are the risk factors, or what are the causes? Maybe let's start with the causes, which are the same, causes and risk factors for hypertension.
Okay.
Yeah.
Basically, we may look at hypertension, or rather hypertension is looked at in the sense of what are the predisposing, which is almost what is the same word as risk factors, like the circumstances that would push you towards having hypertension, or that will actually lead you to have hypertension. So there's hypertension categorized as one that is there in the family, in the bloodline. That's what we call primary hypertension, or essential. So that's people in family hypertensive. Maybe your parents, your siblings, your grandparents, along that line. Then there's definitely genetics as a leading factor, which would lead somebody to, or predispose somebody to be hypertensive. Then there are also lifestyle factors. Smoking, yes, cigarette smoking or tobacco smoking would lead you to be hypertensive. Excessive intake of alcohol would also predispose you to hypertension. Obesity, excess weight would predispose you to hypertension. And then, of course, the factors that would lead to obesity would revolve around nutritional issues, and as well as lack of exercise, what we may call sedentary lifestyle. There are people who are almost equating that a sedentary pattern of life, is as dangerous as almost having cancer. So just the fact that you are just not engaging your body in active exercise would lead you to a lot of diseases, just apart from hypertension. Then you can also have hypertension because of other circumstances. Mothers who are pregnant can get hypertension during their pregnancy because of the changes that happen in the body during pregnancy. If you have certain diseases in your body, we may call that hypertension secondary to endocrine diseases or other diseases in your body, like thyroid disease could lead you to hypertension. If your kidneys have problems, you can get hypertension. There are certain medications also that can lead your pressure to go up. So those are some of what we may call secondary causes. So we have primary and we have secondary. Largely, 95%, 90-95% of the cases are primary. They follow the lines of the family, somebody in the family. Yes.
Okay. Now, for, say, someone who has a secondary hypertension, would that lead to probably their children or grandchildren getting hypertension? Would that be hereditary?
That may not be, because that's secondary. So if the factor that is leading to hypertension is addressed, the secondary factor is addressed, then that somebody may be off medication, their pressures might normalize depending on the cause. So that is not along the family line. The one that is along the family line is a primary hypertension. We also call it essential hypertension.
Okay. I hear you. Now, I'd love for us to just go through some of the vox pops to get to understand what people know about hypertension. And then we'll be coming right back. One, to answer your questions. So if you have any questions that you have about hypertension, please feel free to ask. We say that this is where we talk about medical issues in a way that you can understand, kabisa kabisa. So if you want us to explain for you to understand, this is the place. And for that, our numbers are very open. That is 0721 105 105 for WhatsApp, 23814. Our SMS code, which is absolutely free of charge. We're live on Facebook on MBCI TV Facebook page. We're live on YouTube on MBCI TV official YouTube page. But for now, let's get the vox pops and then we'll be coming right back.
It is a multifaceted topic, but the few that I know is number one, about hereditary. If you have your parents who have had the problem, they can pass it down to you as their children. But number two, and this one is very personal to me, I have a relative who was previously okay, but upon undergoing surgery, they developed the complications, and in the process, their blood pressure was not stabilized. Then they started having high blood pressure. Thirdly, I think old age, when especially in where we are living in Kenya, most of our parents, and when we become old, we don't have proper health care. So with age, high blood pressure also comes in. Number four, I think lifestyle. Once you consume lots of sugars, you do a lot of junk food, I think you're susceptible to high blood pressure. And number three is just ignorance. Probably you might be having some underlying issues in your health, but you don't go to check out from a health facility. You know, for us Kenyans mostly, you must be sick for you to go to a hospital. Most of us don't just go for a checkup. So if you don't check up on your health time and again, you're susceptible to developing high blood pressure without your knowledge.
Okay, high blood pressure kulingana na vile najua ni mpigo wa damu yenye inapiga yenye sio kawaida, yani zaidi kuliko vile inatakikana. Vile najua high blood pressure, yani inamaanisha msukumo wa damu yenye inaenda zaidi ya vile inatakikana. Inasababishwa na mishipa ya damu ikikuwa nyembamba kuliko vile inatakikana ikue, na huwa inasababishwa sana sana na nini? Kulingana na vile najua inasababishwa na kunona zaidi ya kiasi. So hiyo mshipa inakuwa inaenda inazibwa na hiyo mafuta mingi, hiyo cholesterol, alafu ndio inafanya sasa mshipa ya damu ikue kidogo, alafu damu sasa inajisukuma kwa nguvu kuliko vile ingetakikana.
Causes of high blood pressure, I can say some are age related, like the older you grow, sometimes the pressure goes up, and also if you have ailments like diabetes, it can cause the pressure to go up. And some causes are some conditions, some medical conditions can cause also like pregnancies, the high risk. They can also cause the blood pressure to go up, and stress, of course, the major, the obvious.
Blood pressure inakosiwa na vitu kadhaa, lakini basically ni food. Ile food yenye tuna consume huchangia sana blood pressure. Blood pressure hainanga age. Blood pressure inaweza shika mtu mzee, inaweza shika kijana, na pia inakosiwa na factors. Other than food, utapata kuna wale watu wa hasira, mostly wao hupata pressure, na stress. Stress pia huchangia sana sana wase kupata pressure. So kuavoid ni mtu akae fiti, asikue stressful na maisha, akae tu, yani akue tu sawa. Na anakula poa, akipata mayai huko town, kula hiyo balanced diet na itakuwa fine.
High blood pressure inaletwa na kitu kama stress hivi. Stress ndio sana sana hapo hivi. Wakati uko na stress, Unajua sasa pressure sasa ndio inaongezeka. Alafu sasa pressure ikiongezeka, sasa sijui tena zinarudiki aje chini. Unasikia mtu amededi juu ya blood pressure, sijui imekuwa juu. Alafu high blood pressure pia inaletwa na si diabetes. Unasikia wase wengi wako na diabetes ndio inakujaga na hiyo pressure. Sijui sukari imepanda, sukari imeshuka, umecheki saa vitu kaa hizo. Hapo hivyo ndio sana sana.
So that's it about the people that we've heard. Doc, let's start with is it the first guy or the second person who've mentioned about age factor? Yeah, maybe talk about that kidogo.
Okay. Aging comes with several changes in our bodies.
Yeah.
Because as we age, our organs wear out, tear and wear. If we are principally looking at hypertension from our primary definition as increased pressure within the arterial circulation. And then this is when we come back and ask ourselves again whether the classes we attended in physics were helpful. Physics itanisaidia wapi kwa maisha.
Yeah.
Force over area. If during aging, technically because of the aging process, your blood vessels become a bit narrower as part of aging process.
Okay.
So when they are narrower, it means the area is small. And if we just have the same force pushing blood, and the area is the denominator is small, the pressure would go high because the pressure is the resultant factor of force over area. So that is also one of the things that contributes to high blood pressure in aging. One.
Yeah.
Two, aging attracts other issues. In the process of aging, you probably would have other challenges in your organs.
Yeah.
Your kidneys functioning begin to reduce. And you see, kidneys are principally helpful in balancing fluid levels in the body.
Yeah.
So when they are not able to do that proper balancing, and there's more retention of the fluid in the body, then your pressure would be high because you are really overworking your system.
Yeah.
Also, possibly your heart is also wearing down. So it's that aspect of aging that could lead to hypertension.
Okay.
But it is also true to say not every old person is hypertensive because our bodies age differently as well.
For sure. Now, let's talk about stress. But maybe before that, have you maybe had anything else on the segment that we just had that you'd love to address? What did you say as a doctor?
As a doctor, yes. I think largely there's some level of knowledge among the public insofar as understanding what hypertension is, you know. And even in the Bible, in Isaiah 33 verses 6, it says, wisdom and knowledge shall be the stability of our times.
Yeah.
So even in this current dispensation, we really need people to be knowledgeable.
Yeah.
And having forums where, like I was saying, I think there's a gentleman who looks to me like he does just basic work. He really has some level of understanding of what blood pressure is.
Yeah.
He's able to associate, which I really liked, something that I don't mention early, that even people who are diabetic can also be hypertensive.
Yeah.
So diabetes is also another risk factor of hypertension. So when I picked that from somebody who is lay, I figured out that the public, they also mentioned about, is it overweight? There's a term they used there, I've forgotten. But again, that also speaks to the fact that people are conscious of some of the risk factors.
Yeah.
Yes.
Okay. How is diabetes and hypertension related?
The aspects that a diabetic person would experience is diabetes tends to affect most of the organs in the body.
Yeah.
Your blood vessels, your kidneys. So when those are affected, they will also be able to, because the science of hypertension has to do with how your blood circulating and how you retain fluid volumes in your body.
Yeah.
So if those are affected through some mechanisms that is a bit scientific, then your pressures will continue to be high. Also, apart from diabetes, if you have high fat levels. Yes, and the easiest way to see if somebody has high fat levels is if the fat levels accumulate, they get deposited in the blood vessels, they also narrow the blood vessels. So diabetes and high fat levels are also very closely associated with hypertension.
Okay. You've mentioned the fat levels, and I remembered there's a discussion that we had, and we had people, I'm forgetting the name, saying about cholesterol.
Yes, cholesterol, yes.
So take us through what cholesterol is and how is it related to blood pressure.
Blood pressure.
Yeah. And in layman's, are people saying, Nilambo hati yangu iko na cholesterol. Yeah. So how is that related?
Okay. So cholesterol is just, when we talk about, you went to what kind of school? Was it a polling station?
I'm a group of schools.
I'm a group of schools.
Yeah.
Yes. So cholesterol is just the medical language for fat, fat levels. So we say cholesterol, and fat, we are referring to the same thing.
Ah, okay.
But now cholesterol is grouped. It's grouped in there are different kinds of fats.
Okay.
Basically, there's saturated fats and unsaturated fats.
Okay.
Yes, that is the basic science. You know, fat comes from those compounds we used to study in chemistry. Carbon, hydrogen, oxygen.
Yeah.
Our chemistry teacher tortured us with those ones.
Yeah.
So saturated fats are likely the ones to have the more of the hydrogen parts or component, and they are fats that are coming from animals mostly. Yes, the animal, the meat, milk. So those are saturated fats. The unsaturated fats are coming from plants mostly. And so when they are metabolized or processed in the body, then they are grouped. There are different groups. High density, low density, triglycerides. So those ones now can be assessed. You can go to a doctor and they send you to the lab, your blood is drawn, then they assess. So there are levels that will be able to tell this fat is high, this fat is low.
Okay.
The only good fat that is there is the high density lipoprotein. Is considered as a good fat. So if it's more, it's okay.
Yeah.
So we basically try to let people understand that move away from the saturated fats. Because the saturated fats, now in the basic way we understand it, are the fats that would remain solid in room temperature. Ile mafuta inakaa ngumu, ile yenye inachotwa, unaweza hata chotea 5 bob kwa kiosk. So, but now the unsaturated fats are the ones that are liquid in room temperature.
Okay.
And basically that is what we usually tell people. Use the liquid fat when you're making your and just also don't use a lot. Use little. So when you have so much fat in your body, it affects various organs. The fat can be deposited in the vessels and around the organs. So what we say, if the fat is getting deposited in the vessels, it can lead to high pressure. If it gets deposited around your organs, around your abdomen, even around your heart, and stored in other places, it leads to excess weight. And when you have excess weight, you're giving your heart a lot of burden. So the heart has to work against a lot of burden. So the pressure has to go up because of the stress that the heart is experiencing to supply blood to the parts of the body.
Well explained. Now we understand. But I've loved what you've said, that do not take saturated fat. We speak sana about usikule kitu kana mafuta, don't take a lot of fat. But now it's good that you understand how exactly does that work. And why is it that we say, don't take a lot of fats. Just make sure that at least unakula something that is good. Take a lot of water. Niliwaambia nitaendelea kwa daktari. Take a lot of water.
Yes.
You said about unsaturated fats and plants.
They're mostly from plants. You know, plants also produce fats. Like the fat that we get in the shops is from sunflower, from corn. Yeah, so that is what we call unsaturated fats.
Okay, works well. I think that's something that you're supposed to look into, Sana, because you're so used to taking a lot of junk and junks with fats. Yeah, guilty as charged. Let's talk about stress. We've had people relating stress to high blood pressure. Alikuwa na pressure kwa sababu alikuwa na stress. Is that related in any way?
Yes, stress factors, yes, would result to high blood pressure.
Yeah.
Because your body is sent into releasing stress hormones. And those stress hormones, in a way, as they work in the body, they constrict the blood vessels and they give your heart a lot of work to do. So it is best on that mechanism that then you will be able to see somebody pressure going up. If the stress factor is addressed, then everything returns back to normal. If the stress factor stays for long, it means your blood pressure will be high. And you know, we also as individuals respond to stress differently. Yes, so stress is associated with hypertension. Yes, so when you are subjected to a lot of stress, definitely your pressure will go up. Yes.
Okay. I hear you. I see someone asking, anasema good morning. Good morning. Anasema Kahugu, quick question. Anauliza, is it normal to have a headache when your blood pressure is dangerously high? First of all, why are you waiting for your blood pressure to be dangerously high? But let's talk about it. Yeah.
When you say dangerously high, then it's also important for me to go back and say that there are stages of hypertension. Yes. There's a level where your blood pressure is considered pre-hypertensive. If your blood pressure systolic is between 130 and 139, you are pre-hypertensive. And diastolic between 80, let's say 85 and 89, or 80 and 89, you are pre-hypertensive. So if your blood pressure jumps to between 140 and 159, over between 90 and 99, that's stage 1, hypertension. If again it jumps between 160 to 179, over 100 to 109, that's stage 2. If it jumps above 180 and above 100, then that is considered to be stage 3, and it can be dangerous at that level. So I am getting to that staging because of the use of the word dangerously high. So when your blood pressure is dangerously high, it's an urgent issue, or rather, it's an emergency, not even an urgent issue. That's what we call hypertensive emergency, especially when your blood pressure is dangerously high and you have some part of your body, an organ, like having a headache, that needs to be addressed immediately. So it is not normal, it is not good to have your blood pressure high, dangerously high for that matter, and as well have a headache. You need to be attended to in a medical facility as an emergency case, because you are in what we may also call hypertensive crisis. That's a crisis, because you can easily lose your life. Or get a complication that may be permanent.
What are some of these complications that come with hypertension?
Good. Commonly, you can get a stroke. In the medical language, stroke is regarded as an accident, cerebrovascular accident. An accident in the circulation of blood in your brain. That's why we call cerebrovascular. So you can have an instance where, because of the high pressures of blood within the vessels, the blood vessel bursts, and then blood is poured in your brain, some part of your brain. Then you lose some functioning, depending on which part of the brain. You lose some function. So that is what we call stroke. You can get problems with your eyes if you've been hypertensive for long. You are not able to see things properly. That is possible. You can get problems with your heart, what we may call heart attack. Yes, that's a complication. You can get problems with your kidneys. Your kidneys just shut. They can't function properly. You need to be on dialysis. That's also a complication. Worst of all, you can just die immediately when your pressure is very high and no one has been close to you to assist in terms of controlling the blood pressure.
Okay. You've mentioned something about heart attack. And I'm just referring to a question that we had earlier, where people are asking, is it possible to get a heart attack and survive? And not die, rather? Would you get, like, should you call it a heart complication? Is it the same? And survive?
Yes, it's possible. There's the general use of what we may call heart attack, and there's another word we call cardiac arrest. Yes. So an attack, when you say a heart attack, it's the same thing that can happen if you're walking and thugs attack you. So if it's a good day for you, not for the thugs, they may just hurt your body and go and pick a few of your valuables and disappear. But if it's a good day for the thugs, they might kill you. Recently, one of our friends was just attacked. He told me that the thugs had a panga, but they did not use the sharp side to hit on him. They used the blunt side. I think the angels were really with that gentleman that evening. So you can get heart attack and survive. So a heart attack would basically be a part of your heart has stopped to function. Maybe because the circulation of blood, you know, when blood circulates in any part of your heart, it sends with it the food that the muscles need and also oxygen. So you may get that, what we call in the medical language, myocardial ischemia, myocardial infarction, and if you are attended to on time, you can survive. If there's a delay, you can die. And when you die, that is when we call you've gotten a cardiac arrest. Yes. So it's a complication that needs to be attended to on time.
Perfect. So what I'm getting is that as much as it's a silent disease, it's something that is very crucial that we really need to look into. And as you said, is that go get checked. Si lazima uwe mgonjwa ama kuwa na feel ni kama, you know, my body, like I'm having a headache. No, you said it's a silent disease. So just go get checked and make sure that your blood pressure is okay. Umesema once a month, yeah?
At least once a month, check your blood pressure.
Okay. Now, I see we have questions coming in, and we'll be getting to look at some of the myths that surround hypertension. But even before we get there, what's the treatment for people who have hypertension? Is it a lifestyle condition? No. Life what condition?
Lifestyle.
It's a lifestyle condition. Okay. Is it a lifestyle condition, or it's something that you can treat and you're good to go? You live without medication?
There's a time, I remember reading a quote when somebody was mentioning that hypertension runs in their family. And further to that first statement, somebody added and said, it's because no one is running in their family. So lifestyle in this case, yes. And also the genetic aspect. It's a disease that can run in the family. And it's also a disease that can be present in the family when no one is exercising, when no one is running. So basically, the two things are true. And we can manage hypertension by just some lifestyle choices that we're able to just play around with them. Food has been brought to the table, don't add salt. Don't put excess salt. I mean, just that.
Really?
Yes. I mean, those are some of the things that we tell patients who are hypertensive. Use little salt. And the science of the salt is simple. More salt retains more volume of fluid in the body. Yes, and then now it gives the heart more work. We ask people to exercise as a lifestyle modification, being one of the ways we manage hypertension.
Okay.
So in terms of the exercise, I mean, there are different ways we exercise, but the simplest of all will just be walking. If you're able to do about 300 minutes a week of just moderate exercise or walking, that's okay.
Okay.
If you are a more vigorous person, that's we can reduce it to 150 minutes a week. Like if you go to the gym and then you are there. Okay. So gym people, they take about 45 minutes to 60. So between 45 minutes to 1 hour.
Yeah.
So if you multiply by 3, 45 times 3 is about 135. So we say about 150 minutes of vigorous exercise.
Okay.
That is sufficient.
Okay.
If you can't do that, just walk about 10,000 steps. 10,000 steps in a day.
Yeah.
Walk. It may be difficult to walk to work in the morning, but when you're leaving, if you live in an accessible place, walk. Skip a rope in the house. So do something that will be able to enable your body burn excess calories.
Yeah.
So modification is important. Other choices would be stop smoking. Just smoking is a bad thing.
Yeah.
Reduce alcohol. Yes.
Even just stop alcohol.
Yes. Yes. Stop alcohol. Yeah. Really, you really don't have to take that. Yes.
Okay. I hear you. There's someone who's asking about why is hypertension a silent killer. We've mentioned that, and it's just because haina symptoms. Yeah?
True.
Haina symptoms. You'd never know.
Rather, maybe the right word to say, it might be present without expressing the symptoms. Yes, because hypertension has symptoms and has signs.
Okay.
So it's possible you can have your blood pressure being high, but your body has not gotten to the level of expressing the symptoms. Yes.
Okay. Okay. And when it gets to the level of expressing the symptoms, what are some of the symptoms that you'd pick?
Oh, good.
Yeah.
A headache is one of the easiest way to pick.
Yeah.
Some people, when their blood pressure is high, they can have nose bleeding. Your body can feel very weak. You may feel your heart is beating faster. You may express even a complication for the first time. You're just getting a stroke, and by the time you get to hospital, is when you're being told you've been having your blood pressure high. Your heart beating faster, your headache, just the general organs of the body getting tired. Those are some of the basic symptoms that hypertension can cause.
Okay.
Yes.
Okay.
And the symptoms are now worse when it's already gotten to a complicated stage. You're not able to see properly, blurring of vision.
Yeah.
You probably you're hearing some sound, tinnitus, some ringing in the ears.
Yeah.
The pressure is very high.
Okay.
Those are some of the ways you can be able to tell somebody is hypertensive.
Okay. Would you have the fast heartbeats or the palpitations? Would that be a sign?
It's possible,
Yeah.
yes.
But what else would cause the palpitations? Assuming your heart is
Beating
racing,
faster, okay.
you check your blood pressure, iko sawa. Would that mean that you need to keep checking just in case there's anything? Are there other causes of palpitations?
If you have your heart beating faster and you've checked your blood pressure and the blood pressure is normal, it's possibly other causes. The easiest would be maybe if you're anxious, you're worried about something, that can cause your heart to beat faster. If you have, if you're on some medication, there are types of medications that can also cause blood pressure going up. They can also cause your heart to beat faster. So you need to reevaluate and ask yourself, are there drugs I've been taking? You could also probably have problems to do with your thyroid. Commonly, thyroid diseases can cause your heart to beat faster. Yeah. So those are some of the things that could easily tell that your heart is beating faster and your pressure is normal, but these are the causes.
Okay. I see. Now, there's someone who's asking, once diagnosed, do I have to keep taking medication for life?
Good. people or patients battle a lot with that question, and it's really, even from the person who is asking that question, it's really something that it's important for people to understand that you can take the medications for the rest of your life.
Yeah.
Once you are started on medication, your primary doctor or health practitioner would advise you to stick to a certain schedule of follow-up. And sticking to that schedule of follow-up is for them to understand, are these drugs controlling your blood pressure adequately?
Yeah.
Have we gotten to the level whereby your blood pressure is no longer well controlled with these drugs? We need to change. Have we gotten to the level where you are experiencing complications because of those drugs and we need to change them? Have we gotten to the point where your blood pressure is becoming more stable? We need to reduce the dosage of those drugs.
Okay.
Or have we gotten to a point where the curve has flattened? You can withhold taking medication but continue and follow up so that we just continue to see whether we are normal.
Okay.
So yes, when you start on drugs, it's the follow-up is what determines. But starting drugs, especially for hypertensive people, you could take your drugs normally.
Yeah.
If the factors that cause the blood pressure to be high were short-lived, then you'll be off the medication.
Okay.
Maybe if it was pregnancy, you've delivered your baby, and now things are normal.
Yeah.
Maybe it was a bit of stress for a short time, you've addressed the stressants, and now things are normal.
Yeah.
Yes.
Okay. So it really depends.
It really depends.
Yeah,
Yes,
so you have to go get checked. And I love that every time we have any discussion, anything medical, we say, you have to go to the hospital. Because there's one of the gentlemen who spoke and he said, Wakenya tunatakanga tu kwenda hospitali when we feel sick. Yeah? So as you said, it's very important to do regular checkups.
True, yes.
Yeah, and as you've said, with your primary doctor, if you are hypertensive. Yeah? Okay. Now, I have a few minutes for us to take a very short break. But before we do that, let me just look at some of the other questions that are coming in. Anasema anaitwa Finn kutoka Barut. Swali ni, mtu akisikia side moja ya mwili wake kama mkono ama mguu inauma, inaweza kuwa ni hypertension?
That question, yes, Finn, inaweza kuwa ni hypertension na tena inaweza kuwa si hypertension. Yes, sasa ni vizuri wakati unajihisi, if you feel your body, kama unasikia mwili wako uko na something ambayo ni new, it's not been the normal, ni vizuri uende ukue uangaliwe.
Yeah.
And wakati wowote unaenda kwa hospitali, anyone ambaye anaenda kwa hospitali, baada ya kufanya registration, the first stop mtu anapelekwa ni mahali unapimwa pressure, joto, uzito, hizo zinaitwa vital signs. Hakuna daktari anafaa kukuona akutibu kama hujapimwa hizo vitu. So that is the reason why, because we could just pick something abnormal even from that point, even before you go to see the doctor.
Okay. The management of vitals.
Vitals, yes, the vitals.
Okay, I hear you. We have Martha, anasema I was pregnant 4 months. Nikapatikana na high blood pressure. Wakanipea dawa, but I had a miscarriage. Nikaandikiwa check-up after 2 weeks. And one of the doctors advised me not to take a lot of water. So I got confused kwa sababu maji ni high. Please advise.
Okay. Wakati ambapo tuna advise patients not to take a lot of water, is usually when they already have a lot of fluid in the body.
Yeah.
Yes. And probably we don't want to overload them. Kwa sababu wakati uko na hypertension, or you can have diseases that make you to retain a lot of fluid in the body.
Okay.
So wakati kama huo, we now advise patients that they need to be a bit moderate in the volume of water they take, so that they don't overload their system. I want to believe that she was at that particular position where the analysis or the evaluation by the doctor had indicated that she has some fluid overload, and so she was not required to take excess water. Yes, taking water is always the good advice, but when you have fluid overload in your body, we now tell you to take just little water or just moderate volume of water. Yeah, so that is possible as an advice from a doctor.
Yeah. Also, I absolutely love what you've said, and I think for a patient like her, it would be important to maybe get the advice from the doctors, because as you've explained, it's not something that he'll just get. Angeshinda kishanga, sasa mbona naambiwa nikunywe maji, na unajua maji ni uhai. So maybe what I'd get from how you've explained is that when you have some questions about your health and you've been advised by your doctors, you can just ask for clarification from your doctor.
Fantastic.
Yeah.
We're also living at an age where we're having more of us in this, able to, we are not like in many years ago when doctors used to be like gods, or assistant, junior gods, so that you could not ask them questions. But we need to have our patients get the appropriate explanation when they are leaving the consultation room and going back home. What you call patient education. So once your doctor tells you this, don't do this, and you have a question still lingering in your mind because of that advice, just seek more clarification. Seek additional. Tell doc, kindly explain to me, because you are also the same people who keep telling us we need to take a lot of water. Why at this instance are you telling me not take a lot of water? Then they will give you an appropriate explanation as per that particular time, and also as per the evaluation of your own body at that time.
Okay. Perfect. Absolutely love that. Now, we have 2 minutes, and I think this is a very intense question. So I will ask about Nani so that I will let you know. Okay, you've not written your name, but do not worry. I'll make sure I ask your questions once we come back. So in 2 minutes, we'll be taking a very short break, and then we'll be coming back. So as we come back, we'll be coming to answer all your questions. I see you have so many questions which are coming in. But at the end of the show, we'll be able to share the numbers so that you'll be able to, 1, call, but 2, go and get checked. We've said that going to the facility is way better. And you'll be advised Kamuko Nakuru, where the facility is and how you can get help. But we'll share the number so that if you have any questions and you do want clarifications, you'd get help on that as well. But for now, there's someone who's asking, is it possible to get to check your blood pressure at home?
Very possible. You just have to have the blood pressure machine at home, and then know how to do it appropriately, then check it. So there are people who, and we actually advise what we call self-monitoring, self-blood pressure monitoring at home. Yes, so you can get a machine and just check.
Perfect. We'll come to talk about what that machine is, because I know most of the people who've been to hospital, you've seen. But kama ujakua, I'd advise, by the way, if you want to know what the machine looks like, end hospitalini, go get checked, and then you realize, kumbe this is how it looks like. Yeah? So for now, let's take a very short break. This is Afya Clinic. You're getting us from MBCI TV, ambapo tunabadilisha maisha by the grace of God. So we're taking a very short break, and then we'll be coming right back. Today we're talking about hypertension.
MBCI Television, transforming life.
Ni mnyama mgani kwa Biblia? Kuna mnyama kwa Biblia mwenye aliongea. Ni mnyama mgani?
Punda.
Wakati gani?
Alichapwa na jamaa fulani hapo hadi akabonga.
Kuna hii neno bazoka. Bazoka inakaa nini?
Bazoka. Bazoka inakaa bazu akaomoka. Bazoka.
Mtoto ndiye anatawala hii nyumba ya huyu kijana wangu. Chantel.
Baby girl.
Unataka kuniongelesha pia?
Nataka tu niambie tu kweli, usinidanganye.
You are my daughter.
Kwanza wewe, you're such a traitor. Toka! Get out of my room. Get out!
When the ground moves, only strength and precision can get the job done. At Rift Valley Heavy Machinery and Professional Training Institute, we don't just move the earth, we move possibilities. Equipping professionals with world-class training, innovation, technology, because every project demands expertise. So, are you ready to power up your career and take control of your future? We train you to operate all kinds of machinery, shovels, bulldozers, excavators, graders, rollers, and many more. At Rift Valley Heavy Machinery and Professional Training Institute, you get more than just skills. You learn basic mechanics, plant mechanics, first aid, defensive driving, and even take refresher courses. We also offer courses in hospitality, cosmetology, ICT, cottage industry, mechanical and electrical engineering. And guess what? New students get a 10% discount. We conveniently located in Subukia along Nakuru-Nyahururu Highway. Call us on 0707 539423 0707 539423 and start your journey to success today.
Nairobi, a new sound has risen. 96.9 FM, commanding the airwaves, breathing life into every home, a sound of hope, a voice of truth, a well overflowing with living water.
Kuna mipaka tumesukuma, kuna mahali hatukuwa tumefika maeneo katika redio yetu ya MBCI, lakini hayo maeneo sasa Mungu anatupa. Tunaingia Nairobi, tunaingia Mombasa, tunaingia Marindi, tunaingia Ramu.
A station with one divine mission, transforming lives. From soul-stirring worship to life-changing conversations, we speak light into the darkness and faith into the heart of the nation. MBCI Radio, tunabadilisha maisha. Now broadcasting from the heart of Kenya's capital, Nairobi, 96.9 FM and beyond. The sound of heaven, right from where you are. My station, in my city, for revival.
MBCI Radio.
Welcome to Goshen Medical and Technical College, Thika, where dreams become reality and futures are empowered. At Goshen, we offer a wide range of courses in both medical and technical fields designed to meet your aspirations. Medical courses such as clinical medicine and surgery, perioperative theatre technology, orthopedic and trauma medicine, health support, community health, nursing, and many more. For applied sciences, we have applied biology, science laboratory technology, analytical chemistry, environmental science, medical engineering, industrial chemistry. For technical courses, we have plumbing technology, electrical engineering, medical office administration, food and beverage production, hairdressing and beauty therapy, and many more courses that will prepare you for the current job market. Our students receive hands-on experience through industrial attachment, which is organized by the college to ensure valuable technical skills. Goshen College is conveniently located at Thika Makongeni, right off Garissa Highway behind Leather Industries. For more information, contact us on 0750 264 044.
MBCI Television, transforming lives.
Perfect. You're back. Thank you so much for staying. This is MBCI TV ambapo tunabadilisha maisha by the grace of God. And this is Afya Clinic where we talk about everything health in a way that you're able to understand and in a way that you relate. So if you have any question that relates to your health, and today we're talking about hypertension, this is the place where you get to get all your answers. Sawa sawa. So karibu sana. I see we have a lot of questions that are coming in and we'll be able to answer all of them. But for now, let me just check. Oh, yeah, and today we're here with Dr. Eugene. Thank you so much for being here.
Oh, yes,
yes.
My pleasure.
And we're getting to answer all the questions that you want. You've explained everything about hypertension in an amazing way. Very simple way where people are now able to understand what exactly hypertension is. As you started, you said that hypertension sometimes sounds like a really huge disease that you might not be able to understand, but you've explained in layman's language, and I think that's amazing. Now, we've had someone asking how they are able to monitor blood pressure from home. Nanasema, if so, are there home machines? So we'll be doing that in a very short while. We'll show what the machine looks like and how we're able to go about it. But what are some of the daily habits that a patient who has hypertension should have? Or what should this person be doing on a daily?
Okay.
Yeah.
First of all, anyone who's hypertensive, on a daily basis, they'll probably definitely be on medication or not, depending on the stage of the hypertension and the advice they have been given by their doctor. So in talking about a patient who is on medication, they should be able to take their medication as prescribed. Most hypertensive medication have to be taken daily, either once or twice. So you take your medication daily as prescribed. Number two, it's good to have an idea about the name of the drugs that you're taking. If you can't get the names very well, have a photo or an image or get some write-up and put it in your wallet. If you don't have a phone that can take a photo, at least unatembea nayo, so that down when you probably have traveled and you forgot your medication home, you will still be able to remember and go and buy in a local pharmacy. Number two, also whether you are on medication or not, on a daily basis, we advise that you take a bit of exercise, walking, if you're going to the gym, so that you exercise your body. Number three, I would also advise anyone who's hypertensive to be able to consider their dietary. We have this diet where we call it's DASH diet, dietary approach to stop hypertension. So reduce salt, reduce calories, reduce fat, get more nutritional advice if you need, and stick on that on a daily basis. Take adequate amounts of water, about 2 liters a day, accordingly, and just stick to healthy lifestyles, avoid stressors on a daily basis.
Okay, perfect. Now, we have a question here, and they're asking, hi doc, can underweight cause high blood pressure? Can being underweight cause high blood pressure?
We don't have any scientific evidence linking underweight to high blood pressure. You might be underweight but still hypertensive, maybe more because of genetic predisposition. Somebody in your family, hypertension runs in your family. You have a lean body, but you're still hypertensive. We find a lot of cases like that. Somebody comes, they don't have problems with their weight, but their pressure is high.
Okay, I hear you. Anasema, hi doc, mimi blood pressure imenisumbua sana. Weight yangu iko sawa, waist yangu iko 36. I was told that nipimwe cholesterol. What would you advise me tafadhali? Let's start with, why is the waist number important? Surely, you're talking about hypertension.
In the general discussions, we more look at BMI, the body mass index, where we are looking at the proportion of your weight over your height. In what we call the SI units, the standard international units that we also taught by our maths teachers.
Yeah.
So weight in standard units is kilograms, and height is in meters.
Yeah.
So you take your weight, divide by height squared. Yes, height squared.
Okay.
So you get what we call BMI.
Okay.
So if your BMI is in between 18 and 24.9, that's normal.
Okay.
If it's below 18, you're underweight. If it starts to shooting over 25 to 30, you're overweight.
Okay.
If it goes above 30, then we start discussing about stages of obesity. So that is what we commonly look at, especially when you go to hospitals.
Yeah.
But more, we are looking as well at the proportion of your hip to waist ratio.
Okay.
So your hip, the largest circumference you can ever get below your umbilical line is what will be the hip circumference, the largest circumference you can get.
Okay.
And then now you take your waist. So that is what we look at.
Okay.
So if for women, their hip to waist ratio should be about 0.8 to 0.85 as normal. So if it goes above 0.85, it means it's very high, and it's giving you more risk factors for cardiovascular diseases. Diseases to do with the heart and the blood vessels. Those are cardiovascular diseases.
Okay.
For men, if that ratio is above 1, for men, we have a bit of leeway.
Yeah.
And then that also gives you more risks for heart diseases like hypertension and also diseases to do with your blood vessels.
Okay.
So in other situations as well, people look at the hip circumference over the height. So they look at their waistline to hip ratio, but also you can look at your waistline to your height. So your waistline to your height should be halfway as normal. It should not exceed halfway. So for example, just for simple understanding, if your waist is 20 inches, so that is 50 centimeters. So you should not be more than 1 meter. In terms of your height.
Your height. Okay. Okay. Maybe that's something, because it's something we can test at home.
Yes.
Maybe it's something people can try.
Yes, so you can look at those parameters. But it has more significance in the sense that how much fat is accumulated around your major organs, because that gives you more risks. So people are more keen also looking at, apart from BMI, people are keen at looking at the hip and waist ratio. So you can actually have all those things normal, but still be hypertensive. It is important that you also take blood pressure, even if all those things are normal. It's also important to check your cholesterol levels. Anyone who is hypertensive, we advise annually, check how your heart is functioning, do an ECG, check how your thyroid is functioning, check how your liver is functioning, check how your kidney is functioning, check the fat levels in the body, at least once a year. The minimum can be once a year. You can do it twice a year, just for purposes of understanding how your organs are still coping well in spite of being hypertensive and taking medication.
Okay.
Yes.
Okay. Well explained. Well explained. Anasema, hello. My question is, so this is the same person ambaye alisema aliambiwa sikunywe maji nyingi sana. So anasema, my question is, walinipea dawa, nikitumia nasikia akiumwa na kichwa upande utosini, upande wa roho na kwa miguu. Okay. So anasema alipewa dawa, but akikunywa akona headache na anaumwa na miguu. I think that's what I get. Upande wa roho, I haven't gotten what you've said, but maybe you can text very well. But two of the things ambayo amesikia ni anaumwa na kichwa, alafu pia anaumwa na mguu once he's taken the medication.
Thank you so much kwa huyu ambaye ameuliza hiyo swali. Kwa sababu mwili zetu zote zina respond kwa madawa kwa njia tofauti. Unajua kuna effect ya dawa kwa mwili wetu na kuna effect ya mwili wetu kwa dawa. One person two people can be given the same drug, one responds well, na mwingine anaanza kupata side effects. So ukiwa umepewa dawa na umepata side effect, basi ni vizuri urudi kwa daktari wako tena, haangalie, akuambie kwa hizi dawa ambazo uko nazo, hizo effects zenye una mention ni kwa sababu ya dawa moja hapo. Alafu anabadilisha. Kwa sisi tukianzisha mgonjwa yote kwa dawa, when you started on medication, it's never easy to tell how you're going to respond to that medication outrightly. There are certain clues we can have after making an assessment, checking all your organs, doing tests and understanding that these drugs are good for you. But once we start you on drugs, we want to also monitor. Usually, the first time you'll be given drugs maybe for about 2 weeks. Ndio wajaribu kuona vile mwili yako ina respond. Kama dawa zinakupatia side effects, basi unarudi unaambia daktari, mimi nikimeza hii dawa napata side effects. Ndio maana hata ukienda kwa hospitali tunakuuliza, do you have an allergy to this drug? Because we want to understand whether you are reacting to it so that we don't give it to you. But if we didn't have that knowledge before, that you are reacting to this drug, and we started you on it, then when you begin to get those funny and bad experiences because of the drug, go back to the doctor. Ataangalia hizo dawa na atarelate, kwa sababu kila dawa tunajua hii can cause this side effect. Atarelate, atasema hizo side effects we mention, they are because of this drug. So they'll change it to another one.
Okay. Anasema, good morning. Last week we found my father lying down unconscious. He was taken to hospital and we were told that the blood pressure was high. He almost lost his life that morning, but he had woken up very well. What happened?
Well, and I'm really happy at least the dad was well taken care of. Vile alipeleka kwa hospitali, and they must be very good children. They responded well to how their dad was unwell. There are many possibilities, and the first question that one would want to find out is, huyu baba yao, was he hypertensive or not? Or it could also be one of those cases where he may have been an unknown case of hypertension or an undetected. Looking at the global statistics, almost half of the number of the estimated hypertensive people are not known to be, have not been detected. They're just walking around, but no one has been able to detect that they're hypertensive. So that is a possibility. And number two, in asking, somebody woke up very well, then a few minutes, a few hours later, becomes unconscious. That is just how funny this disease is. You can just have hypertension, you were going about your normal duties very well, all of a sudden, something just snaps. Something changes in your body. That is how unpredictable a complication can arise. Yes. And the usage of the silent killer is because of such kind of observations. Somebody was very okay, became unconscious. It probably would have been a different conversation if their dad was unconscious and no one took him to hospital by now. Okay, I hear you. So I'm also glad that your dad was well taken care of. But again, you need, as Doc has said, you need to now be very conscious with acha yaangaliwe, ajulikane this is what the problem is, this is the medication that he should be using, nisikwe another case. Now, let's get to see the vox pops, not the vox pops, the myth busters, so that we'll get to check what are some of the myths that surrounds, hypertension, because this is usually a case that tunaipata sana, about people who are hypertensive. So let's get to look at the myth busters. And the first myth buster that we have is that young people don't get hypertension. Is it true? That's not true. We are really getting more younger people with blood pressure that is elevated, with high blood pressure. And there's no age discrimination. So you could be in your teen years, and when you go to hospital, your blood pressure is high. But also, as of this duration, these times we are living in, our young people are also consuming different kind of things that had not been there before. In terms of their social behavior. And so that can also be one of the pointers that is likely to be causing young people to be hypertensive. The kind of things they consume, some of them, if our ancestors rose up from the dead, they would really just, the brains would just blow up. So we have young people taking different kind of drugs or substances of abuse, that all these have an effect in the body. Yes.
You know, you say that and I've just remembered. Maybe let me just check. There's somewhere I saw yesterday who in the Bible saw a vision and then it was so scary for him that he fainted. There's someone in the Bible, maybe our director would check for us. There's someone who saw a vision in the Bible and he was so scared that he fainted. And then someone said that I read this story and this man probably saw the days that you're living in right now.
I think so.
I think so. Because the young people think they're doing it. Oh, we need God. We need God. Okay, on to the second myth buster. That says that if I'm on medication, I don't need lifestyle changes.
That's very risky to take as an assumption. You really need to balance those two approaches, where you are taking advice on the modifications of lifestyle and taking medication. Why? Because progressively, as you age and maintain the same lifestyle approaches, your body will gain more weight, will have more complications, and you'll have to be given higher dosages of drugs, or those drugs will fail to act very well, and now that will cause more complications. So it is always advised, if you're hypertensive, because it's associated with lifestyle patterns. Adjust those lifestyle, modify some of the things that you do, stop some bad behaviors, so that then you can be able to manage your blood pressure very well. Otherwise, you are actually shortening your time around here on earth. Maybe you love things on the other side of this universe more than here.
Okay, so on to the third myth buster is that once my blood pressure is controlled, I can stop taking my medicine.
If your blood pressure has been controlled because of taking medication, once you stop taking medication, then the blood pressure will go back to the high levels. So go as per the guidance of the doctor or your primary healthcare provider, practitioner, to be able to advise you accordingly. Because I come a lot more times with this kind of mindset from patients. They say, mimi naona pressure yangu iko sawa, I don't need to take drugs anymore. You know, your blood pressure has been controlled because you've been taking medication. So once you stop, the blood pressure will go back. So it's only, what usually we do is we adjust. We adjust the dosages and then we still follow up. There are certain times when the blood pressure drops so low, we can withhold. But you can never take that from your side as a patient. Go as per the advice of your doctor, so that then you're able to tell very clearly, it's my doctor who's given me a short break on medication, not your own self. Don't be your own physician.
Your own doctor. Okay, I hear you. On the last one is that only overweight people get hypertension.
Oh my goodness, that's entirely wrong. That's entirely wrong. We have quite a number of people who are hypertensive. They are of normal weight, and they are hypertensive because maybe it's in the family. So overweight alone is not the only associated factor with hypertension. Okay, so that's it on that. But I know that we've had other myths. So if you have something that you're not sure if it's true or it's a myth, you can always text us through our numbers and we'll be able to demystify. Tujue kama ni ukweli ama this is a myth. But I believe that most of the things we've talked about, and it's important for us to always just follow everything that the doctor says. As doctor said, don't be your own physician. All right? Anasema, hi doc, can the feeling of tiredness on the side of the neck near the shoulder be a sign of high blood pressure? Yes, it can. And it's more dangerous if we are talking about the left side. If you're talking about the left side, there's a likely telling that there are changes also that could be happening on your heart muscles. So if you feel some pain on your left side of the chest, extending to the jaw, left side, and also to the left shoulder, that's a very dangerous sign. Kindly get to the nearest facility where they can be able to do an evaluation as simple as an ECG, which just checks the rhythm patterns of the heart, and they can be able to advise accordingly. It can also tell you have high blood pressure, amongst other things that could possibly be an issue. It's a dangerous thing to have a chest pain, especially on the left side.
Okay. So go get checked. Sawa sawa. Anasema, hi doc, how does hypertension and diabetes follow each other? You had explained this, but maybe for the sake of this particular person, just mention about it, kidogo.
I consider, I mean, I know as Kenyans, we're all cousins, as stated before, but I consider hypertension and diabetes as cousins as well. Just because they're all what we call, in the general language, metabolic diseases, they affect the functioning of our organs. And so this functioning of our organs are interrelated. The way your heart functions is related to the way your liver, because they communicate. They communicate. So when you have your sugars up, they can bring complications that will lead to hypertension. When you have hypertension, they can bring problems that can also make the aspect of how sugar is being metabolized in your body be a problem issue, and then the sugar levels become high. So you find that in most instances you may get somebody who is hypertensive, then after years they're diagnosed with diabetes, and the other way around as well. But there are also people who are just principally they are diabetic and they don't have hypertension, or they're hypertension and they don't have diabetes.
Now, we also have someone who's asking, can alcoholism cause hypertension? You've told them so many times.
Yes.
Please look at this camera and tell them not to take alcohol in the name of Jesus.
Being very clear, alcoholism. And what's the definition of alcoholism? Alcoholism is addiction to intake of excess alcohol. I think that's the terminology. Intake of alcohol has an influence in how it's metabolized. Alcohol is metabolized in your liver, in the kidneys, and it affects those main organs. And once those key organs are affected, it has a likely chance of bringing your pressures very high. Yes, we have people with what we call fat liver disease because of alcoholism. Their kidneys get problems because of prolonged use of alcohol. So it's a dangerous thing to be, I mean, really. You can take other drinks. You don't have to take alcohol, honestly, yes. It definitely can lead to hypertension from medical grounds. And personally, if you're able to, I advise that stop alcohol, stop smoking, stop all dangerous social habits, so that then you're able to have your body in good balance.
Perfect. Now, with that said, we'll be getting to take a look at this particular segment ambayo imetengenezwa na Sylvia Wanja, which is healthy living, that will tell us about how to live a healthy life. Okay? So we get that and then we'll be coming right back.
Good morning and welcome to Afya Clinic, your trusted health companion. Today we talk about a condition that many people have, but very few know about. Hypertension, also called high blood pressure. It's often called the silent killer because it usually shows no symptoms until it causes serious complications like stroke, heart attack, or kidney failure. So, what is hypertension? It simply means the force of blood pushing against your artery walls is too high for too long. When this happens, your heart works harder and your blood vessels become strained. The risk is real because uncontrolled high blood pressure can damage vital organs without warning. Some common risk factors include eating foods high in salt and fat, lack of exercise and being overweight, stress, smoking and alcohol, and sometimes it runs in families. How do you know that you have hypertension? Here's the tricky part. Most people feel perfectly fine. That is why it's important to check your blood pressure, especially if you're above 30 or have a family history of hypertension. Prevention and management. The good news is hypertension can be prevented and controlled. Here are some simple lifestyle changes. Number 1, eat smart. Reduce salt, avoid processed foods, and eat more fruits and vegetables. Number 2, stay active. A 30-minute walk or light exercise at least 5 days a week makes a big difference. Number 3, manage stress. Take time to relax, practice deep breathing, or do something you enjoy. Number 4, avoid smoking and alcohol. Number 5, get regular checkups. Knowledge is power. Don't wait for symptoms. Your health is your wealth. Remember, hypertension doesn't show signs, but it can silently damage your heart, brain, and kidneys. Take charge today. Eat healthy, exercise regularly, check your blood pressure. Make the small changes today for a healthier tomorrow. That is it in Healthy Living. My name is Sylvia Wanjaw.
All right, we are back. Thank you so much, Sylvia, for that. And I know that you've been able to just go through what you need to know or what you need to do for you to live a healthy life. Okay? So today we're talking about hypertension, and here is Dr. Eugene. And maybe just before we get to see how we can check our blood pressure, we've talked about high blood pressure. Now, low blood pressure. Does that have any issue? Just work on what you need to work on to get to the normal, your normal place or your normal blood pressure.
Okay.
Yeah.
Well, anything out of the brackets of normal is that dangerous, high or normal or low. So what is good is normal.
Yeah.
If the blood pressure is low, basically, if your systolic blood pressure is below 90 and diastolic below 60, it means there's a problem.
Okay.
With your fluid volume, maybe. If you lose blood, like if something cuts you and then you lose a lot of blood, your blood pressure will just go low, and that can lead you to shock where you have improper circulation of blood in your body.
Yeah.
So when it's low, it has to also be analyzed. What are the factors? Have you lost volume?
Yeah.
Is your heart having a problem with circulation, pumping the blood around the body? So it's dangerous to have your blood pressure being low.
Yeah.
It is dangerous to have your blood pressure being high. It is good to have your blood pressure within the normal range.
Okay.
Yes.
Okay. Perfect. So now let's get to see. We have a blood pressure
machine. Yes.
Yeah? Yeah, that's the right one. So you have a blood pressure machine right here with us. So maybe just show the people what that looks like and how people are able to use it.
So this is the blood pressure. Most of the blood pressure machines we currently have are digital. And so they'll give you values that you can be able to see clearly.
Yeah.
There are those ones we used to use in the olden days, the ones for mercury, they are a bit difficult. You have to have a medical person be able to use that. So the machines come with different brand names, so I'm not really displaying this to advertise for any company.
Yeah.
But the one we are using currently is from Omron, and it gives you a reading, systolic, diastolic, and it has the cuff. So this is connected.
Yeah.
So what we advise is use a blood pressure machine that assesses the blood pressure reading from the point of the arm. We have the forearm or the wrist region machines, and we also have the arm machines. The forearms will be assessing the blood pressure from tinier, smaller vessels, so they may not give you an accurate reading. But the blood vessel here, the brachial artery here, is a bit bigger, and then it's able to assess the blood pressure reading properly.
Yeah.
There are also gadgets that people have, applications that you put a finger, then it gives you a blood pressure machine. Those are very erroneous readings, so you may not be able to rely on them. Somebody did ask whether you are able to have this machine at home.
Yeah.
Yes, it's a simple machine. You're able to have it. You're able to know how to be taught how to just place the cuff on your arm, like I'm just doing, and then you take a reading.
Yeah.
So one of the things we advise is Settle fast. If you've been walking and you get to a place, even if it's at home, sit for 5 minutes fast. Even if you go to a health facility, sit for 5 minutes fast before we can be able to take your blood pressure reading. So we have agreed here with my host that I'll be able to take her reading. She doesn't have a problem with me doing. Excellent. So I'll first of all show her her readings before she can allow it to be public. Can it go public?
It can go public.
Oh yes, so her readings can go public. Her readings can go public. So this is Rachel's readings for today. It's never usually sufficient, especially if you go to a doctor's for the first time and your blood pressure is high. You have to take about 3 readings. Then the average of the 2 highest will be taken. So the 113 is a systolic blood pressure, which is normal. The 86 is the diastolic. So it's just slightly up by 2. It's not hypertensive, but high normal. This is just high normal. And then this is her pulse, which is 62. The pulse is also normal. So generally her blood pressure reading is normal. I'll also take a second reading in the next few seconds. But Rachel is among the many billion of people in this world whose pressure is normal.
Perfect.
Let me do another one. So we'll do another one. That's usually, even at home, when you take your blood pressure, you can take the first reading, then you take the second reading. Sometimes you can even take the blood pressure when you are lying down, and also take the blood pressure when you are seated. So that is how we advise it. Ensure you're not doing anything busy. You're just calm. You're not chewing gum. You're not talking when you're taking the blood pressure at home or even in hospital. Excellent. So that's the same. So it's giving us more or less where we are at, 111/87. The circumstances may not have been the best scenario because when you're in the hospital is the best thing. And also if she would have rolled up her blouse, would have probably gotten the best. But it's a normal blood pressure reading. And that's just the little demo of what you can do. So it's a gadget you can buy. It doesn't cost a lot of money. Please, anyone who's hypertensive, we always advise buy the blood pressure machine, have it at home.
Does it need prescription for you to buy?
No. You can go to any chemist and just, as long as you're hypertensive, you can tell them, even if you're not, just tell them you want a blood pressure machine. They'll advise on the cost. Go for the one that is able to take readings from the arm, not the wrist.
Perfect. So that is it for today's, and it's very important that tumemaliza by showing how you can use the blood pressure machine, because I think that's very important. And I'm very happy to announce that my blood pressure iko sawa. So for people who their blood pressure is okay, but they know they are at risk of having high blood pressure in terms of probably they have a history in their family, what are they supposed to do?
A stitch in time saves 9 used to be one of the proverbs we used to write in our composition. So preventive measures, if you understand this is in your family, start taking early precautionary measures with your diet and your lifestyle, so that you prevent getting to be hypertensive too soon or at any given time within your lifetime here on earth. Yes, that is what we advise.
All right. Now, for the people who've heard you speak, where can they get you? Because I'm sure we're now thinking, we actually need to get checked and make sure that our blood pressure is fine, and probably people who know they're hypertensive and need to come for checkups.
Thank you so much, Rachel, for allowing us to just let the audience know that I practice at Riria Hub, 4th floor. Our facility is called Sterling Healthcare Consultants. So within the Nakuru region, we are at Riria Hub, 4th floor. And we open all the days of the week. From Monday to Sunday. Monday to Friday between 8 a.m. to 7 p.m. Saturday between 8 a.m. to 6 p.m. Sunday between 9 a.m. to 4 p.m. We are available also on call if you need an advice. There are people who are hypertensive and sometimes they need an advice. If you are probably on follow-up treatment and you're a patient or you come to our clinic, we also do home delivery. We also come to homes and be able to take the readings, draw your blood if you need some tests. So we do what we call home-based care. So we are as mobile as much as also we are physical. So we have our physical presence. Jennifer Rehab, for maybe those who don't know, is opposite Cathay Hotel. Just it's called it's not West Road, it's Tomboya. So opposite Cathay Hotel. That's in Nakuru. In Busia, we are opposite Roshena Hotel, and in Nambale, we are opposite the Nambale Sub-County Hospital. So Sterling, as it is, we have 3 branches. Yes.
Perfect.
Yes.
Now, for the people who would love to reach you on calls, maybe you can share your contact.
Sure. I'll be able to let them know that my direct line is 0720 66 8754. Yes. So if you need any advice, you can call me. We also have another additional line if you want. Yes. 0729 14 7171. But the one that has been displayed is more direct. If you call us, if you send a WhatsApp, we'll be able to attend to anything that requires our attention. Yes.
Perfect. So that is it. Thank you so much for being with us on this session. That was such an informative session. As you've said, is that we have a huge number in terms of statistics for the people who are known to have hypertension. And there are people who have hypertension and probably don't know. That's why you've advised for people to probably get this machine or go and get your blood pressure tested or checked in hospitals. But that said and done, thank you so much for this session. That has been good. Thank you so much for being here as well. So we're going to be having Brenda, who'll be taking us through the tips of what we have done today and how we're supposed to go about it. But once again, thank you so much. Please say hi to all your healthcare practitioners at Sterling, and inform them that we'll be coming to get tested, because that's very important, and do the checkups, the monthly checkups, because that's very important. Sawa.
Thank you so much, Rachel.
Thank you. Asante. Perfect. So that is it. Now, for now, we'll be looking at the Did You Know segment as we prepare to get the tips for what you have done today. All right. So for now, let's get the Did You Know segment so that to jog our minds kidogo on what we've done. So the Did You Know segment today is telling us that did you know that the human nose can remember 50,000 different scents? Yeah? Did you know that? Did you know that the human nose can remember 50,000 different scents? Actually, for me, I would say I kind of agree with that, because for sure, because I remember people with scents and things and places. I really relate with scents for sure. Mnaniangalia je ni kama mni trust. We need to build on trust here. I see. No, for sure. I was actually sharing with a friend. I think I also shared with Tasha that I really remember people and things and places with scents. In terms of, if kama nilikusikia na scent flani, and you've not met, say, for an year, na nisikia scent mahali, it will ring a bell. I'll probably not remember it's you, but I'll remember nilisikia nani na scent. I'll remember nilikuwa MBCI. You know, please, if that's the same with you, just text us, because people don't seem to trust me here. If it's a thing, please tell us.
Okay, I'm not relating because I remember specific scents, but mostly inakwanga watu sipendangi ndo nakumbuka this person used to use this.
You need deliverance. You need deliverance. No, for me it's very quick. The other day I had a scent somewhere, and I remembered I knew someone from campus who used to use that scent or that perfume. Does that make sense?
That is good.
Yeah.
It's a superpower.
So maybe you can have that did you know again on the screen, so that mjue it's a thing. It's researched, guys. Please trust me. So the human nose can remember, not just know, remember 50,000 different scents. So maybe that's not for everyone, but I'm a living testimony that it's a thing.
Okay, since
So
it's
that
scientifically proven, I'll just have to trust you.
Yeah,
on
it's a
that
video
one.
we trust. All right, so today we've had Dr. Eugene and we've been talking about hypertension, which is a very important topic for us to talk about. And, you know, because of that, because it's very important for the people who are just joining us, they might not be able to get everything that we've talked about. And that is why we have you here who'll take us through some of the tips of what we've been talking about right here from 7:35, where we started with some music and then got into the conversation. And for that, the floor is yours.
Okay.
Yeah.
So today we had a discussion, and I could see you floating at some point because of the scientific terms here and there. Sema tu kweli. Sema tu kweli.
Look, there's so many things I've learned. Yeah, there's so many things I've learned. Yeah, for sure.
That's a good thing. So if we could have the pointers so that we can begin.
Okay. Perfect. So we can have the pointers, and as we work on your mic, maybe I'll just take you through. Thank you so much for writing this down for us, because it makes it very easy for us to be able to remember everything we've learned from today's conversation. And we start with, what is the meaning of hypertension? So hypertension means having high blood pressure in the arteries. And how Doc explained is that this is the pressure, and it's a good thing that Doc Akwapa, so that if I say anything that is not it, he'll be able to correct us. So it means this is the pressure of when the blood is pumping from the heart to the rest of the body. Am I right? Yeah. So that is hypertension. That is high blood pressure. The pressure that moves from your heart to the rest of your body. Kama iko high, that means that you have high blood pressure. Na tuliambiwa the range at which is normal, which is high, and which is low. So you need to go get checked at least once a month to know if your blood is okay, ama iko chini, ama iko juu. Sawa sawa? Good. So next is that normal blood pressure is when the top reading, systolic, is between 90 and 119. Yangu nilikuwa ilikuwa 113 or 111. Good. And the bottom reading, diastolic, is between 60 and 90. All right? Yangu ilikuwa around 80 something, 87. Yeah. So when your reading is juu, in between 90 and 119, ama chini 60 and 90, it means iko sawa. Up to 139. Yeah, juu. Yeah. So 90 to 139 is normal. Yeah. So one. Okay. So up to 139 is normal. Above that, above 139, that is hypertension.
Okay.
Yeah.
So I'll continue from that. I see my mic is okay.
Yeah.
Hypertension is considered a silent killer because symptoms are not often evident. And the only way to know that you have hypertension is by doing regular checkups.
Yeah.
Go and check your vitals, and that's how you can know that you have hypertension or not.
Yeah.
Because prior symptoms, like knowing, like the signs that you will have hypertension, are not there. And for our next pointer is that causes of hypertension may include genetic factors. That is hereditary. If your dad or your mom say had hypertension, there is a likelihood that you will get also hypertension. And then we have lifestyle habits. And Rachel, let me talk about the lifestyle habits. I think there is a certain type of similarity between the conversation last week and the conversation this week. Just one thing.
Okay.
From the lifestyle habits, we had obesity.
Yeah.
In last week's discussion, we were talking about asthma. That is a completely different topic.
Yeah.
And now we were talking about hypertension. And one of the lifestyle disorders we have is obesity and smoking.
Yeah.
That is something that is recurrent, which means that it's something that can be avoidable. Yeah.
Yeah. I hear you.
And for our next, we
Pointer?
continue with the lifestyle habits. We have diabetes that is related. The doc said there are somewhat cousins, hypertension and diabetes. And then we have stress.
To you.
And then we have stress. And then we have hormones and pregnancy. And then for next pointers is complications can include stroke. That is when the heart is pumping the blood more than it is required, like at a higher rate, it is under high pressure. It can damage organs like the heart and the eyes, and that is how we get the complications. That is eye problems, heart attack, kidney failure, and even possibly death. And some symptoms of hypertension may include headaches, rapid heartbeat, and weaknesses. And I remember one time I was in Kabarak, I am a student there, and I had those symptoms, and I thought I had hypertension, by the way, but I went and got checked. It wasn't hypertension, I was anemic. So it is important when you experience those symptoms, go and get checked. Maybe it's hypertension, maybe it's not. So why guess when you can go and get checked and verify it? Yeah, that was it today. I hope to see you next time.
So did you get treated?
Yeah.
Okay. You're good now?
Did you get already checked? It was a year ago.
Daktari, we can check to see if you have low blood pressure.
No, I didn't. Ni sawa, utanicheck behind the
scenes.
Okay.
So that has been it. Thank you so much for being here. Thank you so much for the pointers. Now we've been able to just know what exactly we need to do. So if you weren't able to join us since when we started, we've been live on Facebook, we've been live on YouTube. You can always go back and rewatch the whole video. We've said it's very important for you to even just have the information about what hypertension is, how to prevent hypertension, not only for you, but also for the people that you live with, your friends, your family, your children, your grandparents. So it's very important for you to just have the information. It's very, very important. So thank you so much for being here. God bless you. Just to remind you that this week we are having the youth conference. Come up hither, right here in Kingdom Seekers Fellowship. And you can see on your screen is that the theme has been claiming the hate, and this is from Joshua 14 verses 12. All right. So this is a conference that's happening at Heaven's Gate. So as a young person, this is the best time for you to go and get impacted. We say that, we have doctors who help us, and, wameletwa na God.
You'll be going.
Okay. Of course. So we have the doctors who really help us, but also it's not only about our health. We need to be well. Uko sawa, your health, but also spiritually, you need to be okay. That's why, even after talking about everything that you need to talk about in terms of your health, we now talk about your spirituality. So as a young person, you need to get impacted. That's why we have such events like Come Up Hither. So if you're around, please go Pale Heaven's Gate so that you can get impacted and get blessed. Others, thank you so much for being here. God bless you. Do have an amazing, amazing rest of the day. My name is Rachel Kahugu. So as you can see on your screens, is that next week from the 1st to the 7th of September, as you very well know, is that every first week of the month, we usually have the prayer festival. Okay, so the next month's word and prayer festival will be praying for the mountain of media, and the theme is the grace of visibility. So just to make it clear, media is not only TV and radio. Media is also social media. Right now we are living in an age where everything is communicated through the media, and we need to make sure that everything that we get from the media is for purification. And it's for our benefit. So be praying for the mountain of media. And tutakuwa pale Heaven's Gate Prayer Mountain each and every other day. Morning devotion itakuwa inaanza 5 a.m. Lunch hour itakuwa inaanza 12:30 p.m. And of course, we'll be culminating with a worship experience. That is 12 hours worship experience on Friday at 5 on Friday from 6 p.m. to 6 a.m. All right? So thank you so much, and please make sure that we attend. It will be hosted by Apostle John Kevani William. All right, so thank you so much. That's it and done. Thank you so much. God bless you. It's 10, so that means that tumemaliza show yetu ya leo, which has been extremely educative. is there anything like extremely educative? It
Yes.
has been very educative. Yeah. So thank you so much. My name is Rachel Kahugu and you're on set with.
And my name is Brenda Kareji. We hope to see you here again next week, same time, same place.
All right. Bye-bye.